Your last weeks must have been filled with a lot of excitement, an overabundance of love, and unfortunately a lot of vomiting. That's how I picture a pregnant woman must be feeling if she's suffering from morning sickness. In today's video we will cover what morning sickness is, how it is caused, and what you can potentially do to reduce your complaints. So make sure to watch the whole video so you don't miss any important information. And for those of you which are meeting me for the first time, my name is Raoul, I'm a medical doctor from the Netherlands, and it's my mission to medically educate you, because educated people make healthier decisions, which is the whole point of this channel. So sit back, relax, and let's get learning. So let's start at the beginning. Morning sickness consists out of nausea, vomiting, and feeling ill during your pregnancy. It's often triggered by certain smells or certain foods. Despite the name, morning sickness can occur at any time of day or night. And furthermore, morning sickness is most commonly present from the 4th up until the 16th week of pregnancy. But about 10% of pregnant women will experience morning sickness even after the 20th week of pregnancy. Which brings us to the question, how is morning sickness actually caused? Unfortunately, the exact cause is unknown, but it's thought to be caused by changes in your hormone values when you're pregnant. It's especially associated with the hormone human chorionic gonadotropin. Other causes for extreme vomiting and nausea are found in thyroid problems and gallbladder problems. However, those are very rare and aren't associated with pregnancy. Next up, even though the exact cause is unknown, there are certain risk factors which can increase someone's risk for developing morning sickness. Those risk factors are being pregnant with twins, being pregnant with a girl, experiencing frequent nausea or vomiting before being pregnant, having an eating disorder, being obese, and having had morning sickness or hyperemesis gravidarum during a prior pregnancy. Which brings us to the potential harms and complications of morning sickness. Usually, a mild nausea and mild vomiting do not actually cause harm. However, severe nausea and vomiting can cause malnutrition, where your body might not get enough nutrients from your diet, and it might cause dehydration, where you may not get enough fluids in your body. This may lead to imbalances in your electrolytes, which are the salts in your blood that balance your body fluids. This can further lead to a low urinary output, causing potential urinary tract problems in your kidneys, your bladder, and so on. This severe type of morning sickness is called hyperemesis gravidarum, and luckily it's rare. And in order to be diagnosed with hyperemesis gravidarum, someone needs to lose about 5% of their body weight or 3 kilograms. Someone needs to have 3 episodes of vomiting in a single day, and there need to be ketones in someone's urine. Which brings us to maybe the most important question in this video. Can you click the like and subscribe button? Because these videos cost me a lot of time and effort to make, and I hope you're learning a lot. If you do, then it would help out the channel tremendously if you did click the like and subscribe button. It's free, you can always change your mind, and it will make me able to help more people. Let's continue to the actual most important question in this whole video. When should you contact your doctor? Do you have a very dark colored pee, or weren't you able to pee at all for more than 8 hours? Are you unable to keep food or fluids down for 24 hours? Do you feel weak, dizzy or faint when standing up? Do you have abdominal pain, a high temperature? Do you vomit blood? Do you have weight loss? Or is your heart racing? Then please contact your doctor or midwife. He or she can help you to find out the extent of your symptoms and the potential underlying cause. Your doctor might further ask you some questions about your current symptoms, the extent of your symptoms, the medication you're using, and your medical history. Afterwards, your doctor might do a physical examination, some urine and blood tests, and sometimes an ultrasound. If necessary, your doctor could also refer you to a gynecologist, midwife, or urologist, depending on the underlying problems and causes. Which brings us to some useful tips to reduce the symptoms you might experience from morning sickness. First of all, choose your foods carefully. It's often best to select foods which are high in protein, low in fat, and easy to digest. Avoid very greasy and very spicy foods. It also helps to divide your meals in smaller portions and divide those smaller portioned meals over the day. Also, make sure to drink plenty of fluids. It's best to drink mostly water, although some sources advise ginger ale or ginger tea. This one might sound overly obvious, but if there are some foods or smells which trigger your vomiting or nausea, then please avoid those. Furthermore, make sure to get plenty of rest, as tiredness can also make you more nauseous. A last useful tip is to rinse your mouth after having vomited, as the acid of the stomach can damage the enamel of your teeth. Hopefully these tips were able to help you, but sometimes tips are not enough, and it would be wise to visit your doctor for some actual treatment. Unfortunately, there are no sure ways to prevent or cure morning sickness. However, taking daily vitamin supplements might help. Your doctor can also prescribe anti-nausea medication. And lastly, in severe cases of hyperemesis gravidarum, a temporary hospital admission might be necessary. I hope you know everything you need to know now about morning sickness. But if you have any questions, let me know in the comment section and I will do my best to answer each and every one of them. Furthermore, for those of you that want to keep on learning, check out the playlist in the description, and it would mean the world to me if you click the like and subscribe button. In return, you will get a notification each week with a new awesome video. Next up, I also posting content on Facebook and Instagram at How to Medicate. Check me out there or check me out in the new video next week. Bye bye.